Tim, you touched on some of the issues that are going to be discussed during the legislative session. So let's give a list of those to our members and let them know what some of the priorities are that TRTA will be focusing on for them in 2015.
Yeah, great question. Our members are aware probably the most serious issue that we're going to have in the coming legislative session will be the Teacher Retirement System Health Insurance Program called TRS-Care. We have a known shortfall that exceeds $700 million. Right now, it's hard to know exactly how much it is, but the last report, it was somewhere between $730 million and give or take a few $1 million. But that shortfall is real. It creates a real threat to our health insurance program. At the end of the legislative session, if nothing gets done to shore up the situation, there are very few options that are available to the teacher retirement system that manages the health insurance program. Really, the only two options that I'm aware of are to raise premiums to cover the amount of the shortfall, to cut benefits, and I guess the third option, which I didn't mention and will now, is to do both. To cut the benefits and raise premiums to make up for the shortfall. So those premium increases could exceed 100%. Benefits could be reduced by an immeasurable amount. It could very well be the draconian cuts that people often refer to when you have this kind of massive shortfall in the health insurance program. So it's a real important topic. It's probably the most important topic that we'll be dealing with this session. There are always questions about what else is on the TRTA legislative agenda. We will always and forever defend the traditional retirement system, the defined benefit plan. There will always be critics that will say, this program doesn't work, we've got to get rid of it, it's not properly funded. We addressed a lot of that last session. Most of the legislators that we've talked to, they're proud of the work that was done. The TRTA partnered with the actives and with the legislature, school administrators. We all came together and we solved a problem that, for all intents and purposes, wasn't a major problem in Texas. For us, it was an opportunity just to make things better, and we did. The important thing will be to safeguard the work that was done last session so that somebody doesn't say, well, we have a health insurance crisis on one hand, and we shored up the pension fund last time. Maybe we should divert those dollars away from what we did in the pension system if it's gotten better and take those dollars away and put them towards health care. You don't solve one problem by creating another. And so we have to protect our defined benefit plan. We have to protect what we've already achieved in the previous sessions and work with the legislature to come with a real solution for the health insurance program. Bill, what else do you have to add on this?
I agree. I think we met the challenge. And Tim, I would just say that our legislators were well informed about our issues last time, and they really, truly wanted to help and solve that problem, be a partner with us to solve that problem. So I was very proud that we were able to work in that collaborative way. And I feel good that we can work in that collaborative way again to solve the problem. The meetings that I've attended at the Capitol, the State Affairs Committee meeting, and those meetings, it was very evident to me that those senators and legislators are looking for solutions. And the other piece of that I would say to our membership is that TRTA has been brought to the table to discuss this. And I think that's a real healthy atmosphere that we have helped create, and a relationship that we have created with our elected officials to bring us to the table to solve the problem, to come up with solutions, and resolve, hopefully, what will be a good outcome for us at the end of this session.